Welcome into the News 10 Plus Digital Desk. I am Taylor Gattoni alongside Eric Hipple, former Lions quarterback and also a speaker, speaking on continuing the conversation of breaking the stigma surrounding depressive illnesses like suicide. And so, Eric, thank you for joining the News 10 Plus Digital Desk.
My pleasure. Thanks for the opportunity and the time. I appreciate this.
Yeah, of course. Now, if you joined us for First at 4, and more specifically Mid-Michigan Matters, you heard a little bit into Eric's story on why he's advocating on spreading the awareness on suicide and also the prevention and the signs to look out for, more importantly. And so, speaking on this all got started, a chain reaction, after your son died by suicide in 2000 at the age of 15.
Yep. Like I said, it was to me it was shocking because I didn't anticipate this could ever happen. But however, afterwards, and I went through, like I said, my turmoil and stuff. I finally reached out for some treatment and ended up going to the University of Michigan Depression Center at the time, and then after listening to a Lunch and Learn, got some treatment for myself, but also enrolled in this mini medical school they had just on depression. So it was about education, and so they ended up hiring me and maybe an outreach coordinator for the depression center. So it gave me free reign, basically, to go and try and build some programs, to defeat stigma, but also to go to hard to reach populations. And one of those is my own population of athletes. The other one is military, but also it's really dear to my heart was also the schools and student, and then of course extension of that was student athletes as well.
Well, you're using your platform to educate people, and speaking on schools. Children go there to learn, and what more importantly, to learn about your mental health, improve that, and passing that knowledge forward. What are you hoping to do in spreading that knowledge to other people by just advocating?
Well, the first one is to save lives, and I think the end result in it is, if things go completely horribly wrong, that's the end result, and that's preventable. How fast we get to it, and do we have enough treatment in place where somebody needs treatment, they get it? Have we defeated stigma enough to where somebody can actually bring it up and talk about it so they'll ask for treatment? And then what is it, go even more way upstream of that, what is it that we can do so all of a sudden we become more mentally healthy or mentally fit, educated, so we see in ourselves what I can do and some tools so I can be more resilient, because ultimately, the more resilient we can be, then the more that we can just go with the waves and the ups and downs of life and say, okay, I can do this. In fact, I can become stronger if I get through this. And that changes the whole picture of a growth mindset, as opposed to feeling like I have no control, there's nothing I can do.
And it's having that conversation about the stigma surrounding all of that and breaking through. And so, tying it back to your son, being a parent, what was going through your head? What are the signs that you wish you knew to look out for? And what were you picking up on?
Well, it's really hard to say exactly what you're going through, because I was struggling myself. The transition after being a professional athlete for 10 years and then going into, I started a business, but it's a new territory for me, so I was struggling a little bit.
That was your identity for a large portion of your life. Yeah. That is a major transition. And so, children, they go through major transitions as well on a daily basis. You're getting into life, learning what life's about. Those transitions.
I'm glad you said that, because I go back and I look at Jeff. He had moved from Utah from his mom. She's been remarried for 33 years now, but came back, and so he was going back and forth. Every summer he'd come out and spend time, but also new high school, new set of circumstances. And just those major transitions and trying to go through that at 15 years old, a lot to negotiate. But from a parent standpoint of view, well, you try and do everything right, and you're trying to do this, and you don't feel good, we'll go to the doctor, but I'm going to PCP, because maybe you've got a cold because you don't feel good, as opposed to let's assess this guy and find out what's going on. Right. So I'm really happy to say there's some things going on out there right now. There's it's called, My Mind, for example, Henry Ford Hospital is going after, they're piloting some programs called Zero Suicide, so they're actually doing assessments inside of PCP offices, where everybody, every time, gets a small assessment, just, question. That's fantastic. The other thing that's going really, really good is, and I work with Blue Cross Blue Shield as well, and they're piloting some programs that are behavioral care crisis management, or crisis care. Yeah. So you can actually 24/7 mobile, they'll come to you, in these different locations they're piloting. But also, so it gives somebody a chance not to have to go to the ER and check into the hospital. I can actually go to a location that almost looks like a living room in a casual environment and talk. It does have clinical behind it, but a lot of the stuff that people go through, they can probably figure it out themselves if they just knew what to expect. But if you don't, and all of a sudden you feel the wheels coming off, and there's nowhere to go, then the wheels do come off. And so I think all this stuff
that
is
breaking point.
Exactly, where all of a sudden death becomes an answer. So we want to remove that off the table by there's a lot more answers, than this one. And if we get to it early enough, then maybe we can get empower them, but also have the outreach.
There are solutions, other solutions to save more lives. And going into the shame, you talk about they can come to you. Sometimes it's hard to go to the resources. You feel in denial, you feel that shame. What is that toll on someone when you are feeling all of these things? And we were talking earlier, life has its ups and downs. Sometimes you're in a mood, maybe the rain is impacting your mood, and you have your good days and bad days. When it stretches for that long period of time, and instead of just feeling it and letting it go, when it becomes almost part of you, how does that make it difficult to transition into life?
It is. I will say this, being in the throes of depression or anxiety, when you feel like there's no out, okay, then all of a sudden your mind starts saying, hey, there's got to be a solution because we're solution oriented. But the solution becomes, I'm not around anymore, because then, and there's also a sense of I don't want to use the word shame, but burdensomeness. I feel like a burden on my family, I feel like a burden on my friends, I feel like a burden on society, and so everybody's gonna be better without me. And so that mindset, comes into play. And so getting to people earlier and having a culture that says, hey, we talk about this now, means that, hey, then here's what's going on. And like I said, when my daughter was struggling at one point in time, one of her friends came up to her and said something to her. And that, it changed the course of her life because she came in and brought it up. But there's other programs that are out there that I'm really excited about. Be Nice stands for Notice, Invite, Challenge, and Empower.
And actually, you have that pulled up on our screen over here. We're going to show you this Be Nice website real quick. If you want to scroll through, Eric, and show what's on there.
I went specifically to the Be Nice team because it's about teams and athletes and student athletes. But Be Nice itself is this cool program, Notice, Invite, Challenge, Empower. It's around raising the elevation. So if I notice something, right, notice the good, because then when I notice it's not good, something's wrong, then I can engage. But notice all the time, be aware of what's going on, and invite yourself into a circumstance where you can actually get involved if you need to, and then, of course, challenge the stigma, and then be able to empower yourself to help someone, but not only that, empower them too.
Yes.
Because when you engage with somebody and they feel like they're not alone, it really gives them a lot of empowerment. But the Be Nice teams, it's actually we have, so we go out and for sporting teams and whatnot, but we actually, all 30,000 high school coaches in Michigan, all 30,000 get part of the training during their annual, rules and stuff they have to go through, and we get part of the training in that. And so that's cool. Yeah. But I know that, if you can strengthen, for me it was really easy to go into, a school and talk to a football team, and I can tell them, listen, if I get your team more mentally fit, I use mental fitness as opposed to mental health, because everyone wants to be more fit in the sporting world.
Right.
But if I do that, then I can also show you can have a more unity team, stronger team, they'll be there for each other. You won't ostracize people, because team is about when one person's not firing, I can help out. But when I'm struggling, you can help me out. So that's what teamwork's all about. Yeah, so I just love it. Yeah.
And any relation you have, whether you're on a team or you're with your friends and family, it's that power in coming together, connecting, and having those people that you can kind of lean on and have that support.
Yeah, and it also changes the whole face. When you're like that, it changes the whole face of competition. Competition is a reality when you're in the sporting world, right? It's competition everywhere.
Yes,
okay,
yes.
Right? Okay. So everybody has a piece of that. But the thing is, a true competition in sports, it should be a learning experience. In other words, it's not about me, burying you and I walk and beat my chest and just kick you in the, in the teeth afterwards.
Yeah,
no,
not good sportsmanship on the field.
It should be about, like, I'm trying my hardest, but I want you to try your hardest because that makes me better. And so even if I don't win the game, but I played really hard, I won, so I learned something from it. And so that growth mindset, again, comes around to life is a journey of learning. It's ups and downs all the time. And if we look at it that way, that means I'm not afraid to try something because, I'm learning from it. Even if I fail, I learn something, and that's really what it should be about.
Yes, no, 100% I agree with that. And we talk about breaking the stigma. You continue to do your best to break the stigma. You are sharing all of these programs. You are talking with the public, engaging people. What more needs to be done to break the stigma? Why is the stigma still around?
I think that it has to do with access, and I say that because we've got more and more access that's happening now, through telehealth, through these urgent care, places you can go to, right, or behavioral care, urgent care.
More therapists as well.
And we've got now social workers that are working within schools. Not enough, but we've got some that are there. And so I think all of that helps defeat the stigma because it's common as it is. But when you actually go to get help, that's where the disconnect is between a student and trying to talk to their parent. And so the parent, oh, no, because they might not have the same page. I hate to say the older generation because I'm it, but anyway, but yeah, it's reality, right? We didn't learn this stuff coming up. They are. Now it's up.
They have the awareness.
They have the awareness, and it's up to us to help them. And so even a student-driven program like Be Nice, is one to where we're asking the students. It's a student-driven program. Where the students are saying, "Here's what we need. Here's what we want to discuss. Here's what we want to talk about." So in this massive portal that we have, they can pull information out and build their own. And anything like student-driven, because they're smart. Kids are bright.
They're intelligent.
They
so
are
smart, always
and
learning.
they're
curious.
And they're in the middle of change. I mean, oh my gosh, what they went through in COVID and everything else, what we all went through. But for them, they have ideas. The thing is, though, is to make that leap. So if I go and say, here's what I'm struggling with, here's what I'm having, and my parent isn't included in, they're going to say, oh no, well that's just, everybody goes through that, and they'll basically undermine, the students. And once you get turned down, it's really hard to back again, and you start feeling a burden again rather than feeling like, hey, they're there as a team to help me.
A lot of us have heard no repeatedly in our lives, being turned down, no this, no to that. And that simple word of just saying yes to someone, especially when they're going through a hard time, how does that help them in the long run?
Well, there's a little game we can play where, I'll say no to you, right? And then I ask you how you feel, but if I say yes, right? How do you feel about that, right? And it's just a whole difference between this and this, right?
And while you said that to me, you also had the body language where it was like, yes, it was the openness and the tone in there as well. How should parents approach their children?
Well, they shouldn't try and be their best friend, okay? They have to understand there's boundaries, and they also understand consequences. And when I say that, it's because when we're growing up, when we're forming our core beliefs and when we're young, we push boundaries because that's the only way we learn.
Yep.
How far can I go before that's a bad idea?
You have to find your edge,
find your limits. So you have to have those, so I can learn. Otherwise, I don't learn. And if I just get strung along for a long period of time and, covered up, and I never learn anything, then I'm not going to turn to that person for help because I know they're not really helping me. They might get me through, say yes, but that's not really helping me with what I need.
Looking for someone to listen and understand you.
So when I say don't be a friend, be a parent, but also understand you have to meet them at their level, right? And not, you want to reaffirm their feelings, right? So they understand that it's okay to talk about this stuff. Yeah.
Being a parent, you care and you love for your child. How can it be hard for you to approach them when all you want to do is protect, keep them safe, but you need to guide them through life as well, help them grow and learn from their mistakes, like you said.
Well, I think part of that is also understanding that we make choices all day long, right? And to give somebody the kudos when they make a good choice, and not just when they make a bad choice. And so I think you start getting a good feedback then from that person, right? So I can trust them because they're saying I'm doing good in real ways, right? Not fake ways. But also when I do something wrong, I might have consequences to that, but they still love me. It's not just I'm turning my back or fine in a disappointment. That's a killer, when you try and ostracize somebody and not engage with them. And that's one of the most painful things in the world. In fact, studies show that just a simple game where we're playing keep away, but all of a sudden I kind of start ignoring you. That shows up in brain scans. It's the same place that physical pain shows up. It's just really so. Anytime you try and set somebody aside or remove them or don't include them, it's really painful for them.
Well, you say that it's not that physical pain of, if someone were to punch you, you would feel that. But even when someone is saying those hurtful words, your body can still tense up. And you were talking earlier about holding that trauma in your body.
Yeah, it stays there. I mean, if you've gone through that, it reflects in the body. Actually, it has long-term changes. In fact, if you go back and start looking at adverse childhood experiences, if there's enough of them, it can actually change their genetic makeup per se to where it actually carries on to the next generation. And so
it's breaking that generational trauma cycle.
Exactly right. Yeah, and be able to treat the trauma and understand that that trauma has a long-lasting effect on your health, your heart, blood sugar, about everything you can do, your mind.
Oh yeah.
Yeah. So, and so trying to stay away from that, or if you are traumatized, then you talk to somebody, right, and work through it. And so you better exercise it out.
Yeah. There's a practice to it. It's like practice in football. You can relate to that.
Yep.
You need to be able to get your mind going and stick with that and getting that help or that training.
Yeah, and if you got people around you that have, let's talk Detroit Lions for a second.
Yeah.
To me, one of the best mental health examples I've seen in a long time, right, has been the Detroit Lions. Dan Campbell came in, they had to change, of course, Sheila Hamp, and then, the change with the general manager, all those changes. But what happened is, Dan Campbell was able to stick in there long enough and believe in yourself, believe in yourself, I believe in you, I believe in you, believe in yourself, believe in yourself.
The words of affirmation.
That finally, yeah, exactly, finally started changing, and then it's like, if he continues to believe in me, well, then I need to believe in myself, right? And so it brought the team together, and everybody's on the same page, and yet it also proposed hope and care is an action word, and so if I care for you, I'm showing action, and I think just those things in itself are so mentally healthy, to do to a group, and
it's the ripple effect, because it wasn't just the belief within the team. You brought all of Detroit Nation and across the country, fans from other teams started believing in the Lions. And so
that was pretty cool. Also, I hate to bring it up, but it was, I think what really helped also as far as the city goes is we were, the hard knocks they had on 2 years ago, or actually we're in the camp with the Detroit Lions. Typically people probably wouldn't want to see that because, what's the Detroit Lions? But watching the coaching staff and Dan Campbell and how they interact and the work they went through and the camaraderie seemed to come together, it gave them enough time for when they went 0-4 for the fans not to turn on them.
Yes.
They said, you know what, we saw this, we believe in them too. And so that whole thing just changed the course. It was really cool to see.
And that translate from the field over into, on the field, that's real life as well, but applying that into your everyday to day.
Yeah. Well, and I think that's the key. If I can have a success here, and I know what that looks like, then that means when I go through a transition, right, I know what that looks like, and so maybe I can, make that transition a little bit easier because I understand I can get through it. I can learn from this, and I will survive. The three things that actually, that are connected to a suicide are, like I said, the first one, feeling like a burden, right, and then I'll say loneliness, but it's not really loneliness. It's actually pushing people away from you. So the isolation, because if I feel like a burden, I don't want to put that on you, and so I'll isolate. And you take those two things, and you have the third one, which is really kind of the unknown, but it's just the ability to override self-preservation, because it's not easy to do, but it's a very difficult thing to do, suicide is. And that's why it takes such concentration, but people that rise to do it, right? Yeah. So all we have to do is remove one of them. So let's not make them feel like a burden. Let's make them feel that way. Let's conclude them so they don't feel isolated. And that right there, you can save a life. Yeah.
Is there anything else, Eric, that you'd like to mention to continue breaking the stigma and saving lives?
Well, it really does take community to do it, because you can have these little pockets where they're doing pretty well, but you're still going to have problems that are happening that aren't getting solved. And I think if we understand as a culture that as community, it's okay to get help, but it's also okay to empower yourself and to ask and reach out and to follow through with it. It's just like addiction. If a person's not willing to, there's nothing you can do for them, right?
Yes,
you can offer, but you can't force them to it, right? And so that means maybe we need to learn that sometimes it's okay to falter, but it's also okay to pick myself up with the support that I'm getting. Yeah.
Yes. Knowing that you're not alone.
Knowing that you're not alone. That's right. Yeah.
And so real quick here, if you have any questions for Eric Hipple, again, talking about the conversation on breaking the stigma surrounding suicide, depressive illnesses, learning the signs and symptoms, that prevention and awareness as well, feel free to go to our YouTube and Facebook page, shoot a question on there right now. Eric can answer that live right here. But real quick, Eric, I'm going to take this down. I know we're getting a little sweaty from the lights over here. No worries. I'm going to bring this up real quick and give you a second to just rest your voice.
Okay.
Thank you for sharing all of that knowledge. But yes, this is our You're Not Alone mental health series. So Eric Hipple, again, former Lions quarterback and public speaker on breaking the stigma, here to share breaking that stigma. I mean, we just said it right there if you've been listening for the past 20 minutes. So go ahead, scan that QR code on your screen. All you have to do, bring out your cell phone camera, scan that QR code, and a link will pop up. Once you click on that link, it'll show you a list of resources ranging from counseling to therapy, psychotherapy, and it'll just give you a few of those different websites that will guide you toward another mental health professional if you so choose, and just a great guidance tool right there to utilize in connecting you with mental health care professionals, with community members like Eric Hipple sharing his story and also his son's story. And Eric, before we end this here, is there anything else that you would like to mention?
There's so much.
I'm sure.
There isn't. No, I'm encouraged. I think there were some good things that came out of, what we went through in 2020, with that, and that was access to telehealth. And so we can actually get to somebody really quick, if they use it. And some people don't like to go to the location. So that barrier is being overcome, which is great. The ability to have a place to go to, so not just an emergency hospital, and sit there in the emergency room because you just don't have the resources, right? And they can only handle extreme cases, not the middle of the cases. But oftentimes, many people are going through something, a breakup that might be natural to have an up and down, or a little grief afterwards, or a little sadness afterwards. But if we don't understand that, and we start feeling that way, and we think, oh, this is depression, or that would be actually a good thing. We don't recognize what's happening to them. They just don't feel right, and they start disengaging, and they start going through those feelings that you have, and they start isolating. Then it just gets worse and worse and worse. And so just the awareness and the knowledge of these things that there are, so you can be prepared for them. So I know if I go through a loss, I know if I go through a move, if I change grades, if my parents get divorced, there's things, these are natural to feel terrible about, but it's also do something about, right?
You don't want to feel terrible. We want to get you lifted up.
But you also want to talk to somebody before it does evolve and then falls off the face of the earth. And
where they can show you the signs, help you understand your feelings, and help you learn how to cope using different mechanisms.
Yeah. And the idea of resilience, people aren't born and being, hey, I'm the most resilient person in the world, but it's learned over time. You learn resilience because you're not afraid to take on things and understand that a failure is okay, because that's how I learn.
Yes.
And so you'll take more stuff on and understand that, if I don't have to, I can pick myself back up when I get knocked down. And I made a career of that. Actually, getting knocked down and getting back up on the field. So, and fortunately, I've been able to reapply that. And so in my general life today, I'm pretty resilient, and enjoy what I'm doing.
Well, you are brave and bold and resilient for coming on here, sharing your son's story, your story, and sharing that with everyone else so that they can help their story.
I appreciate it, and like I said, there's a lot of great things that are coming down the pike as far as on how we do access and how we get to people and whatnot. But one of the greatest things, of course, is just reducing the 800 suicide number to 988, which is great. I can just call that number or text that. Well, not text it, 741-741, I think it is. But anyway,
yes.
So but access is pretty quick, and no matter where you are. If you're with somebody that you don't know how to talk to them because you think they might be suicidal, you can call that number, right, and it'll route you to the nearest in your location. And then you can talk to them and say, what do I say to him or her? Here, I want to get them on the phone, and they can coach you through it. And so it's not just for the person who's struggling.
And again, being a parent, and I'm sure other people can relate as well, sometimes when you do notice those things, those signs and symptoms, it can be hard to approach them because you then don't want them to feel burdened on that. So it goes both ways, having that open, honest communication and breaking those barriers down, not just the stigma.
And you mentioned the word shame. There's also another one that goes with that, which is fear. And why sometimes people won't engage and say, like, notice something, but I'm not going to ask you because, they're afraid of the answer. Because what happens if you say you are, then now, I have to deal with it. And so they'll say things, well, you're not thinking of this, are you? There's ways to make you give the answer that I want rather than the real answer, right? And so by being open like that and be able to throw me back where I was at.
Being open with it, shame.
Shame, yeah. And so people don't ask because they're afraid of the answer, Or parents won't ask sometimes because they don't want the shame they feel if they, something's wrong with my family. And students won't, or kids won't ask if they feel that if they ask their parents that they're going to bring shame to them, right?
So, Eric, question for you. We are in a world now where technology is evolving more rapidly. You have the use of AI, you have the use of social media. When it comes to seeing other people, and you talk about, I don't want to share this, how can that elevate your feelings of feeling down?
Well, like I said, if you're struggling, right, then the worst thing is to be a target. And unfortunately, social media, because you can't see the person, you can't engage with them in a empathetic way and understand them, that they get a lot of darts thrown out there and fake images like this is their life now, where everybody struggles. There's not a person that doesn't struggle in life. Everybody struggles at some point in time. And so it's not going to be perfect, and it's understand that that's not real. And what is real is when I sit down and talk to a human being face to face, whether it's somebody that a friend, or somebody that I may have an association with, or my parents. That's real, and you got to be able to talk that way. It also puts a burden on us as a society, though, is to, if I see somebody struggling, is to engage and do something, right?
Yes, helping them out, help or give a lending hand.
Yeah, or just be there. You don't even have to say anything,
No.
right? It's just being there sometimes is really all you have to do. You don't have to fix it for them because you can't. What you can do, though, and you can't feel it all for them either, so you don't want it all pile on you because as an empathetic person, that gets to be a drain.
You're not responsible for other people's emotions, but
right.
you can help them through it.
You can, right? And you can be aware of it and maybe what they're going through and be there as a support system. Yeah.
Yes. Well, Eric, anything else you'd like to mention? You have covered a lot of great ground here, a lot of knowledge, educating us on how to use this knowledge more importantly.
Yeah. Well, no, I appreciate it, and it's been great. Thank you very much for having me here and also going through this stuff because it's very important, and Yeah.
Yes.
So thank you.
Of course, no questions. However, you know where to find a lot of those resources that Eric was just mentioning. One more time, I'll show you BeNice.org. That is where you want to go. Eric, I'm not sure if there's anything else that you want to show on the website, but you're more than welcome to.
No, that's okay. Take a scroll through it. Just look at it. BeNice.org is the best thing to do. It's a school program, like I said, but the Be Nice teams as well, because that's actually growing. We're actually going to other states.
Yeah.
So the Michigan High School Athletic Association is what we work with here in Michigan. So all 30,000 coaches, I said, get some training. It's fantastic.
Which is amazing, because getting that knowledge to the educators to continue educating that as well, you are helping us out. Thank you.
Appreciate it.
Of course. We
Thank you
like
much,
having
Taylor.
you in our
Appreciate it.
community, Eric. We appreciate it.
Thank you. Yeah. It's nice
All
to meet you.
right. Well, have a great rest of your Thursday, everyone. Make sure to tune in to, News 10 at 5 is going right now, so we're going to hop off here. Have a great rest of your Thursday.